So it's so important that we note the safety guidelines for diets because some people they want to lose weight, they're not doing it safely. They end up either being malnourished or passing out because food is important. Even though they're trying to lose weight, there are some things that are important. So we'll go over some safety guidelines for dieting. Remember, we had safety guidelines. Okay, this is for dieting. When we get to the exercise, we'll also talk about safety guidelines for exercise. But for dieting, number one, prioritize nutrition over restriction. Avoid extreme calorie restriction. Anything below 1,200 calories per day for women or 1,500 for men, unless under supervised under a supervised healthcare provider. Now, anybody who is doing anything more than this is probably going to be on admission because it's not safe to be on your own and be giving yourself this much caloric deficit. As I said before, start with between 500. Then you start with 300 and then get it to between 500 and 750 caloric deficit. Anything going as high as 1,200 or 1,500 and needs a healthcare provider to be really watching out for you. Focus on nutrient-dense foods like lean proteins, whole grains, healthy fats, and plenty of fruits and vegetables. Number two, monitor for signs of nutritional deficiency. Watch for symptoms like fatigue, hair loss, or dizziness. This could indicate a lack of essential nutrients. I also tell people, watch your fingernails. I tell at the bottom of your fingernails, it tells you when you're, lacking nutrition. And even the strength of your fingernails also tells you. So it's important that, because your body will tell you if you're lacking nutrition. So please, please, please watch for these signs. Consider taking a multivitamin if needed. And not just multivitamin, but multivitamin mineral. Let me slash mineral. So consider taking a multivitamin mineral. When you go to the store, you see them, the multivitamin slash minerals. So not just vitamins, but minerals, because these are you need them in only tiny amounts. If you don't get it, your body knows. So consult with your care provider first. Now, we don't want you to duplicate some things that they're already giving you. So that's why you could talk to your pharmacist and say, okay, this is what I'm taking already. Can I take these multivitamin minerals? And then the pharmacist will tell you, oh, you can take this or stop this. They will inform you on what to do. Now, stay hydrated. You cannot overemphasize this. Aim for at least 8 cups of water per day or fluid per day. And if you are very active or if you're in a hot climate, you need to take more than that. You need water. Limit sugary drinks and excessive caffeine to avoid dehydration. When you take a lot of coffee or tea, you're going to be going to the bathroom a lot, and that means you are losing fluid. So you have to replace the fluid. Number four, adjust for medical conditions or medications. Now, if you're taking medications, please let your um, healthcare provider, including your pharmacist, know what you plan to do so that they can, advise you. You consult your healthcare provider if you have conditions like diabetes, hypertension, or thyroid disorders, because sometimes you have to take the medication at a particular time of the day in relationship to food. So ask your pharmacist, okay, I'm now on this diet plan. What time should I eat? What time should I do this? What time should I take my medication? Most importantly, those who have diabetes, because some of the medications you are taking lower your blood sugar. Now, if you had been eating before and the medication already lowers it up to an amount, if you now start reducing the amount you eat, the medication doesn't know that you have started reducing the amount you eat, and your blood sugar might go too low. So you might need to adjust the medication. So let your healthcare provider know so that if they have to reduce your dose based on your new diet, they will know what to do. It's very important because we don't want you to have hypoglycemia, which is low blood sugar, and also hypertension. A lot of people, when they lose weight, their blood pressure improves. So when they are taking an antihypertensive, you don't want the antihypertensive to reduce a blood pressure that has already become naturally, lowered. You don't want to lower it too much because that might cause dizziness and you might fall or have loss of consciousness. So you don't want all that. So if you have diabetes, hypertension, or thyroid disorders, or any other health um, condition, let your doctor know about your reduced calorie intake, and that will help. So ensure that any dietary adjustments align with your prescribed medications or treatment. That's just what I was saying. Avoid fad diets. Keep quick fix diets that promise drastic weight loss or cut out entire food groups. Yeah, I do not support that. Cut out the entire food groups. Some will say cut out carbs entirely. Some would say cut out fats entirely. Some would say eat only um, carnivore. You have to be very careful. I don't want to say this is what you should do, but you have to be very careful on bad diets. So instead, focus on a balanced approach that you can sustain long term. And I can assure you, it's very simple. If you eat less calories than you expend or burn in a day, you will lose weight. Simple, you will lose weight. Track progress safely. Avoid obsessive calorie counting or daily weigh-ins. After the first week or two, you already have an idea of how many calories each thing is. And then you don't have to now keep on calculating and doing all that. You'll be able to, it will come naturally. And just the first few weeks to know, okay, this calories, this, and after a short time, we already know vegetables don't have much calories. Fruits might have some calories, but they are healthy calories. Carbs, you already know, oh, if I eat this measurement of this, this is how many calories it's going to be. After some time, you don't have to, go with your calculator and start calculating anything. You have an idea, and then you'll be able to safely track your progress. So use non-skill victories like improved energy or looser clothing as additional measures of progress. Many people know, clothes that were tight before are now, kind of falling, and you can reward yourself with a new um, attire, a new dress, and then recognize when to stop. If you feel excessively fatigued, irritable, or notice any health decline, pause and reevaluate your plan with professional guidance. Please do not hesitate to reach out when you are feeling irritable, fatigued, or notice health decline. It's very important that you pause and reevaluate. These are the safety guidelines for dieting. So the next module will be about exercise. And exercise will help you lose weight, but also help you tone your muscles.